1 in 8 women will be diagnosed with breast cancer in their lifetime, but we know you can improve your odds with early detection. And Jennifer Carr is an advanced nurse practitioner with UnityPoint Health and here to explain how there are more opportunities this month for screening. Thanks for coming in.
Thank you for having me.
This is really good news, but let's start with a little background. What is the situation when it comes to breast cancer in the Quad Cities? How do we compare to the rest of the nation?
Well, Iowa specifically has a higher cancer rate. I believe Iowa is the second leading cancer rates in the nation. Scott County has one of the higher cancer rates. Illinois is about on par with average cancer rates, but you know, that is why early detection is so important. Mammograms will save lives.
And tell us a little bit about who is at risk.
So every woman, 1 in 8 women will develop breast cancer in their lifetime. So every woman has about a 12% chance of developing it. There are other ladies who have more risk factors that increase their risk for developing breast cancer, and that includes family history, breast density, genetic mutations, and other modifiable risk factors like smoking, sedentary lifestyles, and obesity.
And if you don't know whether you're at risk, you have some services available to help identify that.
Right. We have a high-risk breast program at UnityPoint Health, and anyone can come in. We would recommend having a breast cancer risk assessment starting at age 25, and they can come in and I will evaluate their breast cancer risk and see if they meet criteria for earlier screening or more advanced screening.
Yeah. Now, we have been telling people that early detection is really key to surviving this cancer. That's been going on for years. Are you starting to see any difference? Are we making any headway?
We are making headway. Most breast cancers we see are curable. We are catching them at very early stages. And we, you know, and I always tell my patients, instead of a gigantic car crash, we just have a little bump in the road.
That's a great analogy. And so this month, UnityPoint Health is making early detection even more convenient. Tell us about that.
So every Wednesday evening and Saturday mornings, there are extra appointments for mammograms for those ladies who have busy schedules and can't make it during regular business hours.
So if someone hasn't actually had a screening in the past, what can they expect during the process of a mammogram?
So mammograms are a fairly simple procedure. They are not exactly comfortable, but they are not painful. Your breast will be compressed in a machine and x-ray images will be taken.
It doesn't take long though.
Oh, maybe 10 minutes.
And why did they come up with the idea of these different hours? What are you hearing from women?
Women are busy. With work and kids and life in general, having extra hours for those mammogram screenings just makes it a little bit easier for people to get in.
All right, so how do they access these special hours that you're offering?
If they have a primary care provider with UnityPoint, they can schedule their mammograms on the patient portal. If not, there is a general scheduling number that they can call at UnityPoint. And if somebody doesn't have a primary care provider and would like to have someone managing their breast health, they can certainly call my office as well.
All right, Jennifer Carr with UnityPoint Health, we appreciate you coming in and telling us about special hours. There they are once again, Wednesdays from 3 to 6 p.m. and then Saturday mornings from 7:30 to 11:30, and that is at the Trinity Moline 7th Street campus.